Welcome to Calm Mind and Healthy Body, our channel. Low testosterone, also known as hypogonadism, is a common condition that can significantly impact men's health and well-being. Men need to be aware of the symptoms of low testosterone, as they can often be subtle and easily overlooked. In this video, we will discuss the critical symptoms of low testosterone that every man should know about and the importance of understanding testosterone replacement therapy, TRT, and hypogonadism. Low testosterone can manifest in various ways, including decreased energy levels, reduced muscle mass, increased body fat, and changes in mood, such as irritability or depression. Other symptoms may include decreased libido, erectile dysfunction, and difficulty concentrating. While these symptoms can be attributed to various factors, men must recognize when they may be related to low testosterone levels. Understanding TRT and hypogonadism is essential for men who may be experiencing symptoms of low testosterone. TRT involves administering testosterone to raise levels back to normal, helping to alleviate symptoms and improve overall quality of life. Hypogonadism, on the other hand, refers to a medical condition where the body is unable to produce sufficient testosterone, leading to low levels in the bloodstream. By addressing low testosterone levels through TRT or other treatment options, men can experience improvements in energy levels, mood, libido, and overall health. Men need to consult with a healthcare provider if they suspect they may have low testosterone, as proper diagnosis and treatment can make a significant difference in their well-being. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. In this video, we aim to engage viewers by highlighting the relevance of understanding low testosterone symptoms, TRT, and hypogonadism to their overall health and quality of life. By increasing awareness and knowledge on this topic, men can take proactive steps toward addressing any potential issues related to low testosterone and improving their overall well-being. Low testosterone levels in men can manifest in a variety of physical and emotional symptoms that can significantly impact their overall quality of life. Men must be aware of these symptoms to seek proper diagnosis and treatment. In this section, we will delve into the common signs of low testosterone and their effects on men's health and well-being. Physical symptoms of low testosterone often include decreased muscle mass, fatigue, and increased body fat. Men may notice reduced muscle strength and size, making engaging in physical activities or workouts more challenging. Fatigue and a lack of energy are also common complaints among men with low testosterone, leading to decreased motivation and productivity. Additionally, increased body fat, particularly around the abdomen, can indicate low testosterone levels. Emotional symptoms associated with low testosterone can include mood swings, depression, and decreased libido. Men may experience irritability, moodiness, or feelings of sadness and hopelessness. These emotional changes can impact relationships, work performance, and mental well-being. Decreased libido and sexual dysfunction are also common symptoms of low testosterone, affecting intimacy and self-esteem. The impact of low testosterone on overall quality of life cannot be understated. Men with untreated low testosterone may experience a decline in physical and mental health, leading to reduced vitality and enjoyment of life. Addressing low testosterone through proper diagnosis and treatment, such as TRT, can help alleviate symptoms and improve the quality of life for men experiencing these challenges. Seeking guidance from healthcare providers and exploring treatment options can lead to improvements in physical and emotional symptoms, ultimately enhancing the overall quality of life for men with low testosterone levels. Testosterone replacement therapy, TRT, plays a crucial role in managing low testosterone levels in men, offering a viable solution to alleviate symptoms and improve overall quality of life. This section will explore how TRT works and its potential benefits and address common misconceptions or concerns surrounding this treatment option. TRT supplements the body with exogenous testosterone to restore levels to a normal range. This can be achieved through various methods, including injections, gels, patches, or pellets. By increasing testosterone levels in the bloodstream, TRT helps to address the symptoms associated with low testosterone, such as fatigue, decreased muscle mass, and mood changes. Men must work closely with healthcare providers to determine the most suitable TRT approach based on their needs and preferences. The potential benefits of TRT are numerous and can significantly impact men's health and well-being. Improved energy levels, enhanced muscle strength, and increased libido are commonly reported benefits of TRT. Men undergoing TRT may also experience improvements in mood, cognitive function, and overall quality of life. By addressing low testosterone levels through TRT, men can regain vitality lost due to hormonal imbalances. Addressing common misconceptions or concerns about TRT is essential for promoting understanding and acceptance of this treatment option. Some men may worry about potential side effects, such as acne, fluid retention, or prostate issues. However, these risks can be minimized with proper monitoring and dosage adjustments. Men considering TRT must discuss concerns with their healthcare provider and weigh the potential benefits against the risks. By educating viewers on the role of TRT in managing low testosterone, we aim to empower men to make informed decisions about their health and well-being. Hypogonadism is a medical condition characterized by low levels of testosterone in men, resulting from dysfunction in the testes or pituitary gland. Recognizing and understanding hypogonadism is essential, as it can have significant implications for men's health and well-being. In this section, we will delve into the causes, symptoms, and importance of seeking medical evaluation for proper diagnosis of hypogonadism. Hypogonadism can be classified into primary and secondary forms, each with distinct causes. Primary hypogonadism occurs when the testes are unable to produce sufficient testosterone due to factors such as genetic conditions, infections, or trauma. Secondary hypogonadism, on the other hand, results from dysfunction in the pituitary gland or hypothalamus, leading to inadequate stimulation of the testes to produce testosterone. Understanding the underlying cause of hypogonadism is crucial for determining the most appropriate treatment approach. Symptoms specific to hypogonadism may overlap with general low testosterone symptoms but can also include unique indicators such as infertility, gynecomastia, enlarged breast tissue, and decreased testicle size. Men with hypogonadism may experience more severe and persistent symptoms compared to those with mild testosterone deficiencies. It is essential to differentiate between general low testosterone symptoms and those specific to hypogonadism to ensure accurate diagnosis and targeted treatment. Seeking medical evaluation for a proper diagnosis of hypogonadism is paramount in addressing the underlying hormonal imbalance and managing associated symptoms effectively. Healthcare providers can conduct blood tests to measure testosterone levels and assess other hormone levels to determine the cause of hypogonadism. A comprehensive evaluation may involve physical examinations and imaging studies to identify testes or pituitary gland structural abnormalities. By recognizing and defining hypogonadism, men can take proactive steps to address this condition and improve their overall health and quality of life. Seeking medical evaluation for proper diagnosis is essential in developing a personalized treatment plan that targets the root cause of hypogonadism and helps men regain hormonal balance and vitality. Explore the various treatment options available for managing low testosterone and hypogonadism. Managing low testosterone and hypogonadism involves a range of treatment options that aim to restore hormonal balance and alleviate associated symptoms. From lifestyle modifications to medical interventions, there are various approaches that men can consider to address these conditions effectively. This section will explore the treatment options available and discuss their potential risks and benefits. Lifestyle changes play a crucial role in managing low testosterone and hypogonadism. A healthy diet rich in zinc, vitamin D, and omega-3 fatty acids can support testosterone production. Regular exercise, particularly strength and high-intensity interval training, can also help improve testosterone levels and overall health. Maintaining a healthy weight, managing stress, and getting adequate sleep are lifestyle factors that can positively impact testosterone levels. Medical interventions offer more targeted approaches to managing low testosterone and hypogonadism. Testosterone replacement therapy, TRT, involves administering exogenous testosterone to raise levels back to normal. Clomiphene is a medication that stimulates the production of testosterone in the testes, making it a potential alternative to TRT. Human chorionic gonadotropin, HCG, therapy can also help boost testosterone production in men with hypogonadism. Each treatment option comes with its own set of potential risks and benefits that men should consider when making decisions about their care. TRT, for example, may carry risks such as acne, fluid retention, and prostate issues but can offer significant benefits in terms of improved energy levels, mood, and libido. Clomiphene and HCG therapy may have different side effect profiles and efficacy rates, requiring careful monitoring and adjustment by healthcare providers. Men need to recognize the signs of low testosterone and understand its impact on their health and well-being. Each treatment option has risks and benefits, highlighting the importance of consulting healthcare professionals to determine the most suitable action. We invite viewers to like, share, and subscribe for more informative content on men's health. By engaging with our channel, viewers can stay informed about the latest developments in testosterone management, lifestyle tips, and treatment options. Together, we can raise awareness about low testosterone and empower men to take control of their health and well-being. Thank you for watching. Recognizing and addressing low testosterone symptoms is the first step towards a healthier and happier life. Stay informed, stay proactive, and prioritize your health.